I've talked about the vaccine before when we had the situation where that nurse fainted after getting the vaccine on television and going to do her interview. But this will be much like that one, this isn't going to help news of the day. ER nurse tests positive for 19, 8 days after he received Pfizer vaccine. San Diego ER nurse Matthew W. received the Pfizer vaccine on the 18th. He started feeling sick on Christmas Eve and went in to get tested on the 26th. Matt tested positive for the CV, but has since started feeling better. And while it's surprising to many, it's not unexpected, according to health experts who weighed in on the case. Dr. Christian Rammer said, "It's not unexpected at all. If you work through the numbers, this is exactly what we'd expect to happen if someone was exposed." Rammer said Matthew could have had the CV before he was vaccinated, so that's the spin. I was waiting for some kind of spin to draw attention away from the vaccine as the possible culprit. And I'm not saying it is, I'm just saying that with the way that the media is treating this and kind of how officials are trying to force the vaccination down people's throats, that any kind of bad news that would come out after somebody got the vaccine, that stuff is going to be spun or pushed to the back so that people don't have concerns about it. He received his vaccine on the 18th, according to a post from Instagram. "Got my vaccine. The 15 minutes afterward, sitting around with a bunch of others while healthcare workers asked us how we felt, made me think of an opium den." Well, I don't know what an opium den is like, so I would never think about that, but I'll report back if I start to grow a third arm. Yikes. But on Christmas Eve, Matthew, who works at 2 different hospitals in San Diego, began feeling sick after working a shift in the 19 unit. He told ABC 10 News that he first got the chills before coming down with muscle aches and fatigue. On December 26, he went to the hospital to get tested for the virus and tested positive. And while it's surprising, it's not unexpected, according to health experts who weighed in on the case. We read about that above. Remmer said it's possible that Matthew was infected before receiving the vaccine, and if Matthew did contract the virus after the vaccine, it's still in line with what healthcare professionals know. We know from the vaccine clinical trials that it's going to take about 10 to 14 days for you to start to develop protection from the vaccine, Rammer said. Rammers also said he's aware of other cases where healthcare workers became infected around the time they received the vaccine. So it could have just been coincidence, as they're saying, dumb luck. I mean, this dude did work in a 19 unit, so that's super high risk. A lot more risky than some other units within the hospital. So kudos to this guy and everyone like him who legitimate on the pecking order. Some nurses are more respected than others during this time. Of course, I'm saying specifically for this time. A nurse that works in a COVID-19 unit obviously is putting more on the line than a nurse that works in a different kind of unit. So I think it's fair to give that respect where it's due. That first dose, we think, gives you somewhere around 50%, and you need that second dose to get up to 95%, Rammers added. Matthew says he is feeling better since his symptoms appeared last week. The Trump administration's goal to vaccinate the majority of the U.S. population in the first half of next year has been thwarted by the slow rollout of the program, which at the current rate may take nearly 10 years to complete, according to a new 10 years. And the missus and I were just talking about this earlier in the day. She was asking me kind of like what I thought for 2021, just overall big picture. We talk about those kind of things. And I was saying that just last week they were trying to project 20 million people by the end of the year. And at that time, we were only at like 1 million or so. I think it's up to 2, and it might be a little more by the time you're watching this video. I said that there was no way that this week that we're in right now, they were going to get 19 million people vaccinated, simply because, and I'm not even talking about the rollout itself. I haven't looked into that, so I don't know if that's slowed or if they're just trying to throw in some political jab here. It could be one or the other. The feeling is that a ton of people don't want to take it anyway. So you can have these projections about what you want to do, what you want to see happen. But unless you start forcing people to take it, I better not give anybody any ideas. But the reality is, unless you force somebody to take it, then how are you going to hit those projections? You can't force somebody in to go get the shot. Myself probably won't get it just because I don't need it. I'm not in a risk group to where I would need it. But if I wanted to get it, I would be able to get it pretty easily. Operation Warp Speed officials had promised over the last several months that 20 million Americans would receive the 19 vaccine by the end of 2020, and 80% of the total population would be vaccinated by late June. Again, projections. You can't force people in there, so I think that with these projections, you kind of set yourself up, optimistically. I get it. I get what they're trying to do, but you set yourself up for failure by failing to take into consideration the will of the people. However, data released by the CDC shows vaccination efforts are moving at a slower pace than needed, with just 2.1 million Americans having received their first dose out of the 11.4 million shipped earlier this month as of Monday. Okay, so there you go. At this rate, it means more than 3 million people will need to get vaccinated daily in order to meet the government's June deadline, according to an NBC News analysis of the data on Tuesday. Alternatively, if vaccination efforts continued at their current rate, it will take nearly a decade to adequately vaccinate 80% of the country's 330.7 million residents by then, the report shows. So, short story, but I just wanted to put it out there that this kind of thing doesn't help. It will only kind of heighten the fears in people. And there's individuals with all sorts of theories on the vaccine and its origins, its safety, this and that. I hear it. I listen to what people are talking about. I hear where they're coming from. People have concerns. Some people don't. Myself, I wouldn't necessarily have concerns about taking it. But then you could be like, hey, well then, butthole, why don't you take it? And I'm like, no. No, but seriously, I would really wait a long period of time simply because I'm not in a high-risk group. I don't have comorbidities. I do my thing out there when it comes to working out. I try to stay as healthy as I can, and I'm not in a high-risk situation like Matthew here. Now, he's somebody who definitely would need to take it, I believe. Even if there were a slight risk of side effects, he's somebody out there, as I said, much respect to him, he's out there putting it on the line in a COVID unit, super high risk. So he's somebody that I would say, yeah, a shot for me? No, it's cool. Give it to somebody else like him who definitely needs it. And as I said before about this, individuals who are in high-risk groups, the elderly specifically, and those first responders, individuals who are out there more so day-to-day interacting with the public. If I had the option to take it for myself or let one of them have it, I would definitely pass it on because, again, it's just, I'm not in a high-risk group. Doesn't mean it can't happen. It might. I just try to do what I can do for my own self and my health to make sure that I don't fall into one of those groups that would need it. So, again, like I said, I know individuals, you all out there have your different thoughts on it, whether or not you would take it. But for me, that's where I'm at. So kudos to Matt. Hopefully he continues to recover and do well. But again, it kind of doesn't help, right? So take care, everybody. Thanks for watching. Be well.